Well, good evening, everyone. My name is Carly Shortino Poulter, and I'm the director of the ARC Advocacy Network here at the ARC of Indiana. And I'd like to welcome you all to our Ask the ARC series. Over the last couple of months, we've had a lot of questions from families about the changes that are being proposed for the aged and disabled waiver that is transitioning to both the health and wellness waiver and the pathways for aging waiver, and also the changes that are coming for the traumatic brain injury waiver. There's a lot of confusion and a lot of misinformation, and just a lot of questions about those changes that are coming. And one of the most controversial parts of this is that individuals who are what are called legally responsible individuals, parents of children under the age of 18 or spouses, will no longer be allowed to be paid to provide attendant care for individuals on these waivers, and that's caused a lot of controversy. The state has encouraged those families to provide what's called structured family caregiving as an alternative to that attendant care piece. But again, a lot of people have questions, and there are a lot of issues that still don't have answers yet. But what we've decided to do is we've decided that to bring in a couple of experts to talk about structured family caregiving and some of the changes that are going on. And so on Tuesday night, we had Kelly Tunsdale from CareForth to talk about structured family caregiving. And this evening, we have Evan Reinhardt from the Indiana Association of Hospice and Home Care to talk about structured family caregiving, but also about the nursing piece, because there are also a lot of questions about how nursing plays into all of this. So tonight, unfortunately, nobody will be able to unmute and ask questions, but you will be able to ask questions either through the Q&A section or through the chat. So please, by all means, go ahead and ask your questions, because we know that this is a really confusing situation, and it's something that is evolving on a regular basis. Part of the issue is that the answers are changing as new information comes out and as new decisions are being made. So this is an evolving situation. Now, as you ask your questions, I do want to remind you that we are recording tonight's webinar and we will be posting it online. So keep that in mind as you ask your questions, just so that you're protecting your own privacy. And now I'd like to introduce Evan Reinhardt from the Indiana Association of Hospice and Home Care. Evan serves as the executive director, and he's been a member of the IAHHC team since 2012. He oversees the day-to-day operations and financial health of the association, manages their lobbying and advocacy efforts, provides regulatory guidance and support to their members, and supports the IAHHC team working on behalf of home health, hospice, and personal service agencies here in Indiana. Evan received his Bachelor's of Arts in Psychology from Butler University and his Master's of Business Administration with a concentration in finance from the University of Indianapolis. And then, just because he's an overachiever, got his doctorate of jurisprudence from the Indiana University McKinney School of Law. So I'd like to welcome Evan, and thank you so much for coming and talking with us today. And at this point, Evan, let me turn it over to you.
Thanks so much, Carly. I appreciate it. Great to be with you all here this evening. And as Carly said, we're going to touch on a few things here, but still very much a fluid situation. So we have some answers, but we don't have all of them. Definitely understand the frustration there. And it's frustration that's shared across the board, whether it's parents and families, providers, even as trade association folks we're frustrated as well. So I just wanted to set that stage as we walk through things here. So let me just exit out of the chat there, and a quick agenda, just our roadmap for tonight. So we're going to talk through home and community-based services program options. Carly touched on the attendant care situation with no LRI. Structured family care, there is an LRI allowed, and a couple other programs that you might be experiencing or interacting with. Integrated healthcare coordination. There is not an LRI component, but I wanted to touch on it because it might be a program that you as consumers might be exposed to and providers might recommend. And then likewise for home health services, we definitely want to walk through that and the components of the LRI piece there. I see we do have a couple questions in the chat right out of the gate, so I'm happy to jump in. The first question is about how many hours is respite under structured family care? And I think, I'm not sure if Kelly covered that, but the answer that we're aware of is it's to be determined right now. We don't really have clarity on exactly what a day of respite consists of, and is that 24 hours, 8 hours, 2 hours? So we need to clarify that still. And then a second question for what are single parents supposed to do under structured family care if their child has a G-tube? That's an excellent question. This process and transition hasn't really discussed those sorts of things. We do know that, and we'll touch on this here during the presentation, that the nurse who is participating in the structured family care isn't really doing nursing. So we have that sort of confirmation. They're acting as an individual as a part of the structured family caregiving team, but it's the interpretation of both the Department of Health and the Division of Aging that they wouldn't be doing nursing as the law defines it. So that's another question that we still need to kind of run down and get some answers to. So hopefully that, again, apologize for not having all answers, but we'll try to cover as much as we can here as we walk through the presentation. Always just like to provide this disclaimer. I'm not providing legal advice. I am an attorney, but I am not your attorney, so definitely encourage you to seek out counsel if you have legal questions. Again, I'm Evan Reinhardt. I'm the Executive Director for the Indiana Association for Home and Hospice Care. We're the trade association that represents home health, hospice, and personal services agencies in Indiana. We lobby on their behalf. We advocate for them both in the State House and within the state administration, and we also provide education for them. We really act as a go-to resource for the agencies that are providing those services out in the home and community. And there's my email address. Happy to field any questions you might have as follow-ups. Just want to reiterate this. The environment is very fluid. MLTSS, Managed Long-Term Services and Supports, the Pathways program, was enough on its own to bring some major challenges. The budget overrun and LRI changes have just magnified this significantly and created so many unknowns. So again, I apologize for not having every answer to every question, but that's sort of the nature of the situation right now. And FSSA doesn't even have those answers. A lot of things are under consideration or being looked at more closely or being passed around and being asked for feedback. So there's a lot of different things happening, many balls up in the air. So just bear with me as we kind of walk through things here. So most of you are familiar, with attendant care specifically, provided under the A&D waiver, and will be on the pathways and health and wellness waivers in the future, provided typically through, PSA, personal services agency or home health agency. The training requirements there, each agency has the discretion to determine the competency of its staff. We touched on the discussion earlier that legally responsible individuals will no longer be allowed to provide that care and will be sort of requested to if they wish to continue to provide the services under structured family care. Structured family care, you've already had an expert really walk through things, currently provided under the A&D waiver as well. And will be on the pathways and health and wellness. Could be a PSA, home health agency, or a Division of Aging approved provider. rules for those organizations really mirror attendant care under the 455 of the administrative code. And legally responsible individuals are possible under this program to participate as a provider. The area of focus for us as a trade association has been enrollment of providers. There's been a significant influx of interest in becoming a provider of structured family care because not all agencies were providers of that service. And we're expecting this sort of a change to happen. So a lot of interest in adding that service. Big questions for us because there's been a bright line in the past that a nurse can be employed by a personal services agency but cannot provide nursing services within a personal services agency because a PSA is a non-medical agency that provides mainly assistance with activities of daily living. So there is no nursing component allowed, and it's a major licensure issue if you are providing skilled services within a PSA. So we have gotten confirmation that Division of Aging and Department of Health have spoken and have been really clear that a nurse within this context is not providing nursing services. So they are allowed to be a part of a personal services agency. Capacity issues are, another focus of ours. That was really something that was on our radar prior to the budget overrun and LRI topics. So we, have really been trying to address that, trying to get folks through the system within the AAAs as quickly as possible so that they can begin receiving the service and within structured family care. And so that's really kind of our three main areas of focus there. I do want to apologize to my traditional audience is on the provider side. So my terminology is usually focused towards providers. So do want to just state that at the beginning that I don't mean any offense and certainly wouldn't try to say anything that was not proper in this context, but that terminology is provider focused, so apologies for that. There's a question that came in the chat. It says, as I understand it, LRIs cannot provide care services as an LRI under Medicaid PA state funding. As such, how are home health related services being provided by an LRI via nursing delegation? We're going to get into that, but we do have confirmation. So the Department of Health has been clear that an agency can hire a family member. Likewise, Medicaid has historically allowed family members to be hired. So when a home health agency hires an individual, it can be a legally responsible individual under home health. And that was one of the first things we asked FSSA when they came out with their plan for moving folks to structured family care was, for those individuals that it's appropriate, can they move to the home health program and receive services from what we would call fee for service or PA within home health, and FSSA said yes, absolutely they can. So to the best of our knowledge, unless something changes in the near future, that's the current situation for folks, that they can be hired as a legally responsible individual. Family members can provide that care. So did want to touch just briefly on integrated healthcare coordination. This is a service. The provider types are, typically a home health agency or assisted living facility, but could also be adult day or another FSSA and Division of Aging approved physician practice. A lot of what's going to be delivered here is support, collaboration, coordination. So if an individual has a doctor's appointment or something along those lines, the agency can deploy a nurse and have them do follow-up, any needed sort of coordination of those services, and then can do like post-appointment medication review or transition care if the person is coming out of the hospital and back into their home or the community, as well as some advanced care planning. There is no LRI component here. Provider types are RN, LPN, and licensed social worker. We have an additional question here. Do PA hours being a home health aide for your child affect structured family caregiving, since SFC is a daily stipend and PA hour through Medicaid or hourly? We've gotten confirmation that you can have those home health services as well as structured family caregiving that can take place as it currently stands. So both of those things can happen at the same time. Home health services. So home health agency is licensed by the Department of Health, and they include nursing, physical therapy, occupational therapy, speech therapy, as well as medical, social services, home health aid services, and palliative care. Just a couple references here for where we are licensed, as well as where we find our rules. So home health agencies were, created in federal statute, and then there's a significant, a lengthy number of conditions of participation which formulate our rules for operating home health agencies. And we have a tandem state statute and as well as some state rules, but agencies are bound in Indiana to follow those conditions of participation in order to operate a home health agency. And that really creates our standard of care in terms of how the agencies go about their day-to-day. So what is a home health aide? It's an individual who provides home health aid services, and home health aid services always are performed under supervision of an RN, a registered nurse. And if we touched on this earlier, family member can be hired as a home health aide, but they need to be treated just as any other employee. So they have to be hired within the agency and follow the same training and other competency and any sort of onboarding or policies and procedures that need to be followed. All of those have to be followed by that family member. To perform a skilled task, such as suctioning a trach, the Department of Health here recently has said that an immediate family member can make the determination when suctioning is necessary. This is a limited exception. The individual would still need to clock out because they can't provide that sort of service underneath the home health agency as a home health aide. That's a nursing level of service, and a non-immediate family member must consult a nurse. So in practice, when we don't have family members involved, the aide is not allowed to assess or do any sort of skilled service along those lines. So that's why the information would be referred to a nurse, and that's where the intervention would come from. So to be a home health aide, let me just check the chat here. Question about, I'm finding it difficult to find a waiver provider who will provide services unless you commit to having staff for at least 25 hours a week. And that completely understandable. There are significant staffing difficulties currently. So that's something we're trying to work on from workforce perspective, as well as, through the state and other opportunities. But that's a significant issue all around the state, and particularly in certain pockets. There's a real staffing shortage that everyone's dealing with: personal services agencies, home health agencies, hospices, across the board. So definitely, I understand your frustration there. All right, so to be a home health aide, you have to do one of the following three things. You can complete a training and competency program, and we're going to walk through what that looks like. You can complete a competency evaluation program. So that's really being kind of checked off and assessed for your skill level as a home health aide. And third, you can complete the CNA training and competency evaluation and be on the CNA registry. So those are the three mechanisms by which you can become a home health aide. You've got to also be active within the last 24 months to avoid needing the full training program again, which is 75-hour program. So those are the kind of basic rules. There's a lot more to this. I'm giving you kind of the high points and what's digestible, but each agency is going to have a training program, and you can get more detail if you're in touch with the home health agency. So what does a training program look like? We've got both a classroom component and practical training. It's a total of 75 hours, and then you've got to have 16 hours in the classroom before 16 hours of supervised training as a part of the 75. So here are the topics. This is all listed out in the conditions of participation, and it includes communication skills, verbally reporting information, observing and reporting and documentation of the patient's status, reading and recording a temperature, pulse, and respiration, infection control, elements of bodily functions and changes in body function, maintenance of a clean, safe, healthy environment. That's a big one. It's a big focus for the Department of Health. Hand washing is a major component of the education, and just understanding how to properly wash your hands, and as well as other cleanliness and health and safety guidelines. But that demonstrates, it's down to that kind of basic detailed level. Recognizing emergencies, the physical, emotional, developmental needs of and ways to work with the population that the home health agency serves, including respect for the patient, privacy, and respect for their property. Some additional topics on the training requirements. So appropriate and safe techniques for personal hygiene, and then walk through the list here: oral hygiene, toileting, safe transfer techniques and ambulation, nutrition, fluid, and then any other tasks that the HHA, the home health agency, may choose to have an aide perform as permitted under state law. There is an addition in Indiana. So we now have a dementia training requirement that 6 hours of the training for aides initially has to be for those aides that are going to be providing care to an individual with Alzheimer's disease, dementia, or a related cognitive disorder. And this is how it's listed in the statute. They needed an additional 6 hours of training. And for those that have already been a part of the home health aide program, they would get 3 years of in-service on dementia after they've been working for a year or more. So there is the continuing ed in-service requirement I just mentioned. So it's 12 hours per given 12-month period. It includes communication skills, observing, reporting, reading and recording temperature, and we already kind of walked through some of these, but it's basically you need an additional 12 hours per year on these topics that are listed out, and that can be accomplished via in-person education, online education, just as long as there's documentation that it's been followed. That's sort of the requirement. So some additional questions on the staffing and attending care issues. And that one, so the question is related to whether or not the agency, is going to lose money if it's 25 hours or it's not worth their time. Certainly something you would see on an agency to agency basis. I can't speak to the particulars of that, but I understand your frustration, that they're saying it's got to hit a certain threshold or it's not potentially profitable for them. So again, we're happy to help if we can know more details and that sort of thing. But just based on what you're describing there, I'm not sure I can shed any light on the specifics. Just some further descriptions here of education and in-service training topics. And through our organization, we've developed an online curriculum for training to be a home health aide, at least the maximum component that doesn't have to be delivered in person. We've attempted to put all of that online through an organization called the Rochester Community Technical College. That's where all of our in-services and education have been in the past, and then we spent a lot of time and some significant resources putting together the full online component of the training program. And so that's a resource that exists. We've just rolled that out here recently. Those of you that have been in touch with an agency, you might have heard about that. And we're attempting to make the training as user-friendly as possible. 75 hours is a long period of time to need training. So we're trying to make that as user-friendly as possible and allow that to be done online to the extent possible. And as I mentioned, all the in-service hours and topics are all covered through RCTC as well. So I did want to touch on, Carly was kind enough to pass along some questions. I want to answer the ones that I can and just, I'll tell you for those that we don't have an answer to, we're just working on the answers right now. So can an agency still get prior authorization or fee for service if you're using structured family care? The answer to that at this moment is yes. You are able to get both of those services and be authorized for those at the same time. Skilled respite while receiving structured family care, the answer to that is also yes. We've been told that that is still capable of being received. Skilled respite is actually a separate waiver service. So it's delivered by a nurse, an RN, LPN, or a home health aide. So it requires a home health agency to provide that service. But we have been told that it can be delivered, again, unauthorized at the same time as structured family care. Can you become a home health aide for your own child? To the best of our knowledge, the answer to that is yes. And we just walked through some of those components. You've heard the state is capping hours for both waivers and PA. Is that true? And if so, what are the caps? We have not been told officially that there are any caps for either waiver or PA. What we have been told is that the appropriateness and what the individual's needs are going to be looked at very closely for waiver. And they are already looked at very closely for prior authorization or fee for service within home health. That's the entire purpose of the prior authorization process itself, is really to function as a sort of pre-service step that agencies have to take and provide the documentation and justification for the service, and then a separate entity gets to say whether or not those are approved, and then the agency can move forward. So no caps at this time that we're aware of for PA or waiver, but waiver is definitely going through a transition where there was less oversight for hours authorized before, and now there's going to be a lot more oversight and a lot more looking at whether or not the hours requested are appropriate for that individual. Question here: unfortunately, SFC as it stands is a poor fit for pediatric members on the waiver and shows a poor understanding of the needs of pediatric members and their LRI caregivers. Have you received any guidance from FSSA regarding SFC for the pediatric population, or any indication from them as to when it will be available? I have not received anything, or we have not at the association. We understand, that as I look at this, in my recollection, again, this is just my personal thought, for structured family care, that as it was initially conceived, I don't know that it was necessarily thought that someone with a very acute, or the reference earlier was with a G tube, an individual like that would be on structured family care and receiving the services there. So I think there's a lot of moving parts to this. So we're awaiting guidance, and as soon as we have that, we'll be happy to share it and start circulating that, because there's a lot of changes happening currently. Is there a way to ensure the nursing through SFC is appropriate for medically complex children? I think that's sort of on the same theme as the previous question. And again, the nurse, as a member of the team, is not providing nursing. So there's that component to think of. We touched on that a few times during the presentation. So I think that's one major takeaway from the guidance we currently have, is given that that individual is not providing nursing, for a medically complex child, that presents some complications that we touched on in the previous question. So definitely more to come on that. I think it's something we're waiting guidance on, and just really, don't have a lot of detail with that question currently.
And then
Additional
I've gotten
question in the chat. Go ahead, Carly.
I was going to say, I've gotten a couple of additional questions as well.
Okay.
How will FSSA ensure that there is no gap in coverage during this transition from the aged and disabled waiver to the health and wellness waiver, or to another waiver, from one service to another? How are they going to try to make sure that there aren't gaps?
So as it was originally conceived, really prior to the LRI complications, there was going to be a time period where authorizations were just going to, sort of continue through past July 1, and then there would be sort of a time period that everything would be kind of retroactively looked at to ensure you get through that transition, and then you can kind of reassess once we're past July 1. I don't know that that plan has changed, but I think that's all of our expectation. And then bringing on the MCEs as an additional, third-party oversight to make sure that no one's really getting lost in the shuffle. So, I think that was the plan, to my recollection, and I think that's what we're going to look for going forward. Is the authorizations that exist pre-July 1 will be kind of grandfathered, so to speak, post July 1, and then reevaluated at some point there in the future.
And if I remember correctly, they were looking at a continuation of about 90 days. But I have to admit,
my head too. Yeah. I don't. We'd have to find it, and just track it down. But that was my recollection. Is
yeah.
It was about 90 days where you would have, if your if your authorization was to go to July 2nd, right? That's a huge kind of issue to have the program launch, and then July 2nd have to have some sort of reassessment or reevaluation. So that would continue 90 days, past the July 1 timeframe. That's my recollection too, but I don't have that information at my fingertips right now.
So one of the other questions we got is, what providers will be ready to provide structured family caregiving for pediatrics starting on July 1st? And who's ensuring or following up with these providers to be certain that they have all of the needed requirements in place, like someone to assess the homes for the for individuals who are medically complex and their adaptive needs, and all of those different components?
Sure, and I think that's to be determined. We don't have an answer on that just yet. We, as from the provider perspective, we've just gotten through a period where you could apply to add that structured family care as a service within your agency. That deadline just came the end of March. So we're just now to a point where everyone's applied, and now we can kind of figure out how the Division of Aging, and then in the future, whether it's OMPP, Medicaid, or the DDRS, one of those entities is definitely going to provide some oversight, for whether or not those agencies are ready to provide the service. So that's our expectation, is that'll be answered here in the coming weeks. All right.
So,
When you keep going through the list, or are there a
sure.
couple more in the chat?
Well, those were the other questions that people had sent to me. So now
Okay.
I'm looking at the chat. So one of the issues that has occurred recently is that the state has officially begun a waiting list for the aged and disabled waiver. And so one of the questions is, will there be a waiting list for those who need pathways for aging services? That's a great
That is
question.
not our expectation, that there's gonna be a wait list for pathways. And there hasn't been any indication that would be the case. Really, the objective for pathways is to bring as many folks over to home and community-based services as possible. So, given that as a strategy, as well as the trying to have folks connected with services within 3 days, 72 hours, we don't expect that there would be any sort of limitations on pathways at this point.
Okay. Um, we're new to the aged and disabled waiver. Would parents be able to get hired on through an agency to have training completed before July 1st? And this parent is asking, in particular for structured family caregiving, but I'm gonna also ask, would there be time enough to complete training to be a home health aide as well,
Yeah,
especially with that
and
75-hour component?
yeah, home health aid training can take place at any time. That can happen, or really any moment. So if you connect yourself with an agency and they can put you through a course and the training program, definitely an opportunity to do that pre-July 1. For the structured family care piece, that, as far as I'm aware, can happen at any time as well. So pre-July 1, you're definitely in good stead to reach out to an agency and receive that training if you're able to do so.
Okay. So someone has also asked, are structured family caregiving providers required to also provide caregiver coaching? The answer to that is yes. That is part of the service
Right.
definition. So yeah, they are
Yeah,
required to do that.
that's sort of the fundamental piece of structured family caregiving, is, to have that element where, both through the nurse and the caregiver coach, they're there to give the caregiver all the resources they need to be successful in providing that care on a day-to-day basis. So, yep, absolutely.
And I know that there's been a little bit of controversy over caregiver coaching. I've talked to some families who were, frankly offended at the idea of that, saying, I know my child better than anybody. Why would I need caregiver coaching? And I look at it a different way. And this is just me talking and adding my perspective here, because sometimes new things develop, and if you have a loved one who has medical needs and a new medical need develops, having somebody else that you can talk to about that to figure out, okay, how do we incorporate this into our daily lives, can be really helpful. So like if you've got a loved one who suddenly develops diabetes, having that caregiver coach to talk to about, how do we incorporate this into our everyday life? How do we make those adjustments, can be really helpful. And for those who have children, um, you know, one of the things is kids grow up, and eventually if your children have not hit puberty yet, they will. And being able to talk to somebody about, okay, how do I deal with this issue? How do I deal with this issue? So I don't want people to be offended by that idea of caregiver coaching. Think of it as somebody that you can talk to, somebody who understands the needs of your loved one, that you can bounce ideas off of, and that you can brainstorm with. So that's how I perceive it. And so I just kind of wanted to address that because I've heard that feedback before, and so I just kind of wanted to look at it from a different angle.
Sure.
So we've had a couple of other questions. You said skilled respite can be provided in conjunction with structured family caregiving, but FSSA prohibits the two services to be provided at the same time on the waiver. Do you have it in writing that that will change?
And I think that's something yet to come in terms of the written guidance, but we reached out, asked that specific question, and the answer was yes, that now the two can't be provided exactly at the same time, like, literally at the same moment, but the answer from FSSA was yes, you can receive skilled respite while receiving structured family care.
All right. And then, um, and then the other question was about the wait list, and we kind of addressed that. So I want to continue to open it up and say, if any of you have more questions, by all means, go ahead and ask. Um, but Evan, I want to thank you so much and for talking about all of this, for explaining all this, especially with that nursing component. You really, I think you made it very accessible and made that part easier to understand, because that part gets really, really confusing. So thank you. And thank you for going through and explaining, what those requirements are, what those training pieces are, so that if there is a family member who wants to pursue the idea of becoming a home health aide, that may be an option for them as well. So thank you for sharing all of that. Um, I also want to say, um, because I'm not necessarily seeing anything new come into the Q&A or into the chat, but if you are anything like me, you are going to think of something like next week, and you're suddenly going to have a question and you're going to be like, oh, how do I find that answer? Well, I'm going to say, give us a call here at the ARC. That is exactly what we're here for. Like Evan said, like Kelly said on Tuesday, we may not have answers to some of these questions yet, in part because they are still developing some of these answers. So there may not be concrete answers yet, but what we will be able to do is get you the most up-to-date information that is out there. And so somebody's asking, can we get a copy of the PowerPoint presentation? Um,
Sure. Yeah.
Okay. I suddenly realized, wow, I'm totally putting you on the spot by asking that. So we will have copies of these slides available on the ARC's website through our waiver page, with all of the updated information on the waiver transitions. We will also post this a copy of or a recording of tonight's presentation as soon as we can, so that you can go back and watch it again. Um, Somebody's asking, Evan, can you please clarify if CNAs can work as home health aides?
Yes, yes. So if you're a CNA and you're on the registry, you can absolutely work as a home health aide. You kind of transition to becoming but that all sort of happens behind the scenes. It's a weird function of the home health aide concept, but yes, you can.
Um, is there a way for a home health agency? Well, I think there might be a couple of words missing in the question. Is there a way for a home health agency competency or an individual to be a home health aide without doing the 75-hour training?
Okay, so this is an interesting question. And as it turns out, within the conditions of participation, the three sections that I noted earlier, where it says to go through the full training program of 75 hours, there's an or go through a competency program or be a CNA. And as it currently stands, an agency can competency an individual potentially without going through that 75 hours. Now, the agency has an obligation to ensure that the individual is competent to perform those services. So even though you might not go through the 75 hours, that's something that if you're completely new to home health and never done anything in the past, an agency sees that you don't have that experience and aren't competent to provide the service, they're likely going to take you through the 75 hours anyway. But this is just sort of a rare occurrence where the language in the conditions of participation are worded just strangely. We have had conversations with the Department of Health on this. It's something that we expect change to come to eventually, but as it currently stands, it's an or, so you can do the 75 hours or be competency or be a CNA. Again, more to come on that. It's not always been interpreted that way. Again, I understand we're in the gray here, but unfortunately, that's kind of where we live our lives as these rules and interpretations of the language shift, and particularly in this time period, there's a lot of that shifting happening. So, but that's how you would accomplish being a home health aide without doing the 75 hours.
Okay. All right. Um, and Evan, at this point, we just want to thank you. This has been really, really wonderful information. This has been and very thorough information and very accessible information. So thank you so much for everything you have shared tonight. Thank you for taking the time to talk with everyone this evening. I just want to check one more thing. Oh, somebody does have one more question. Can you talk about feeding tube training for aides?
Sure. So we passed a statute, not this session, but last session, that allows home health aides to provide G-tube and J-tube feedings. The curriculum has been put together by the Department of Health. So any agencies interested in having aides provide that service can provide the training to the aides, and that's how it gets accomplished. That's a recent change, and sort of limited in scope, just to those G-tube or J-tube feedings. And, it's something that we're working on in terms of scope of practice for the home health aides with the Department of Health, and as well as DDRS and all of the other stakeholders involved in the Pathways program and MLTSS changes. That scope of practice is being looked at, but at least as it currently stands, you can provide the G-tube and J-tube feedings as long as you've been trained appropriately.
And so one of the other things that I just want to add is that I know some families will have some additional questions that may vary based on the provider. The agency themselves may have their own specifications of what they want done and how they want something done, especially when it comes to things like, how do we clock in and out to provide to perform certain services or certain supports. So some of those questions may very well be may vary based on the individual provider agency too. So those are definitely things that you want to be able to talk to different agencies about. So it's really important that as you are looking for a structured family caregiving provider agency, or you're looking for a home health agency, or maybe you're looking for somebody else who can provide attendant care. Maybe that's bringing in a different family member. That maybe that's bringing in somebody who's going to nursing school and is doing this as a part-time job. Something along those lines. You want to make sure that you are actually talking to multiple agencies and interviewing them. Remember, you are ultimately the client. And so, you hire the agencies, you can fire the agencies. So you want to make sure that you're interviewing them to make sure that you find an agency who is a good fit for your loved one and is a good fit for you. Because you can have the best agency in the world, but if they're not a good fit for your loved one, it doesn't matter. And conversely, sometimes you can have an agency who may get mixed reviews, but you can find like that one person in their agency who is absolutely perfect for your loved one. So you want to make sure that you're talking with all of them. We've got one more question that has come in. What are the qualifications? What are the qualification trainings involved to provide respite? I have staff through wraparound who is interested in providing respite if possible, and also for structured family caregiving for the 15 days. I think there are certain requirements. There are some basic requirements through the state, and then I would think that each agency has their own requirements on top of that. Evan, do you think that's a fair assessment?
Absolutely. And as I understand it, I mean, that individual has to match, whatever services or skill set that the caregiver had. The objective is to match those with anyone who's providing the respite service. But in terms of formal, macro requirements, there aren't any from that perspective. But matching and individual agencies will vary in terms of what they require to.
All right. Well, ladies and gentlemen, thank you so much for joining us this evening. I want to thank you for taking the time for our Ask the ARC series. I will say that because you've signed up for our Ask the ARC series, you are signed up for all of our Ask the ARC sessions to come in the future. You are welcome to join us for any that you are interested in, but you certainly don't have to join if there's a topic that doesn't apply to you. So thank you so much and have a wonderful evening. And if you have questions, if you want to talk this through some more, by all means, talk with one of our family advocates here at the ARC. Every single one of us is either a parent, a self-advocate, or a sibling. So we all live this life with you. So give us a call at 317-977-2375. Thank you so much and have a wonderful evening. Bye-bye.